I'm really excited to see everyone here today. Thank you for joining us. I see a lot of faces that I recognize, a lot of names I recognize, some that I don't. So for those of you who are new, welcome. I'm Tara Bauman, the Executive Director of the National Aging in Place Council, and we are really excited to have our guest speaker today. I was just telling him this is the first time we have ever addressed this topic in NAIPC history. So I love that, that he's here with us today. This is Russ Bloor. He's calling in from Florida, and he's earned the National Social Security Advisor certification. And that qualifies him to counsel retirees and pre-retirees on questions and issues pertaining to Social Security. And we're lucky to have him here because he can advise us as well. I told him we're a chatty bunch and we tend to have a lot of questions. So if you wouldn't mind keeping your questions till the end or putting them in the chat box, and we'll make sure that they are addressed before we end the call. And for those of you that are watching live on Facebook, if you want to put your question in the comment section there, we will make sure they're addressed either live or recorded. We will go back and address them. So thank you all for joining us today. And with that, I will turn it over to Russ. So thank you, Russ, for coming to NAIPC.
Well, it's absolutely my pleasure. I really appreciate the opportunity to speak with anyone. And just to mention, you mentioned before about the NSSA accreditation, and I actually was just dealing with someone but they just received it. I was accredited by the NSSA about a little bit over 6 years ago, and NSSA accreditation is great, but it's really only basic training in Social Security. You really have to get the experience of dealing with questions. And at the AMAC Foundation, we've dealt with over 28,000 questions since we started this adventure about a little over 6 years ago. So we got a lot of experience under our belt. Now I'm going to talk today. I'm going to go ahead and share, I think, the presentation that we have here. Okay, everyone can see that, I assume. So, as I said, I'm with the AMAC Foundation, and the AMAC Foundation is actually a subsidiary of a larger corporation known as AMAC. That's the Association of Mature American Citizens. And AMAC is a membership organization, similar in many respects to that other major senior organization who goes by the name of AARP. AMAC, we like to think, is just as good, if not better. The difference between our organizations is that AMAC tends to lean more towards the conservative side of the political agenda, whereas AARP is more to the liberal side. Nothing wrong with either one, it's just that it's a different constituency. AMAC has two main subsidiaries. One is AMAC Action, which you see the logo on the left. AMAC Action is the political arm. It's a 501c3 company, so it's a nonprofit, and it's the organization within AMAC that deals with legislative matters in Washington, D.C. The AMAC Foundation, the lower right logo, is of course us, and we have an entirely different focus. Our focus is really to help protect and ensure the financial security, health, and social lives of current and future mature Americans. That's what we focus on, because if you've dealt at all with Social Security and Medicare, you know that it can be pretty bewildering to deal with those things. But the AMAC Foundation actually does more than just those two topics. We do a complete set of seminars, public seminars on general topics vital to seniors, such as cutting the cord, for example, getting rid of cable TV and just use a streaming thing. So it's basically educating seniors. We publish a lot of stuff on matters affecting Social Security. I'll talk in a minute of a couple of ones that are available. We have two websites that are dedicated to Social Security and Medicare. One for Social Security, the one that you see there, Social Security Report. And the Medicare report is, of course, dedicated to Medicare issues. And we also have, I guess, what we would consider our flagship of the foundation, and that is our Social Security Advisory Program. We have a main website, that's the AMAC Foundation website, which, as you can see, is amacfoundation.org. And that is rich with a lot of different topics, including one I want to call out in particular is veterans resources. It's a complete library of information available to our veterans. As a veteran myself, I really appreciate that, as do many of the veterans that contact us for information. We also list any upcoming events we have, which are upcoming seminars and webinars. For example, if you went to that website, you'd see this broadcast as one of our upcoming events. We also have audios and videos of a bunch of different topics, but largely Social Security. In our audio section, we, for example, have an archive of about 110 radio programs that we did in the Washington, D.C. area. So those are, and they're all in different podcasts that you can listen to. So there's a tremendous amount of information out there. So just to give you a picture of the volumes, rather the kind of growth that we've experienced since we launched this whole experiment in January of 2016. At that time when we launched, we had 4 accredited advisors. We now have 6. We now average about 550 to 600 inquiries per month. And as I mentioned before, we've handled over 28,000 questions so far. You can see the trajectory of our growth right there. And from the way that we're starting out 2023, that trajectory is definitely going to continue. So the Ask Rusty series is one of the really exciting parts of our Social Security information. That was launched in early 2017. And what we do is each week we publish an article based on an actual question about Social Security or Medicare that we've received here at the AMAC Foundation and responded to. So those articles every week go out to over 7,000 media outlets all across the country, including Alaska and Hawaii, but it also includes territories. And in fact, some international news organizations have also picked up our articles. For example, Associated Press and some other news organizations such as that. Let me go back to that for a minute. All of our articles are posted on the socialsecurity.report.org website. We now have audio versions, which we publish. In other words, each article that we do weekly, there's both a print version that's sent out to the national media and also an audio version that's sent out to radio programs. The audio version really came out of requests from radio stations for us to give them something that they could broadcast on their radio. And at the bottom, you see 3 books that we did. The first one we did in 2019 was essentially a catalog of different articles that we wrote. And then in 2020, we published that book, What's So Hard About Social Security, which was more of a description, guidebook, so to speak, on Social Security and how it worked. And then we updated that with another book last year called Demystifying Social Security. Both of those books, by the way, are available in print version if you were to contact our office, but they're also available on Amazon. In fact, I think if you are into Amazon Unlimited, the first book is available through your Amazon Unlimited membership. So here's what we're going to cover today. We're going to talk about what's new for 2023, because it is kind of the beginning of 2023. We're going to talk about the basics, including who's eligible, calculation of benefits, and especially full retirement age. And I'm going to get into the importance of all 3 of those things. We're going to talk about when to file and taxation of benefits, talk a little bit about disability, about spouses and how spouses can receive benefits and surviving spouse benefits. We're going to talk about working after one starts collecting Social Security. And we're going to talk about COLA, cost of living adjustments. And the windfall elimination provision, I'm just going to briefly mention that a little bit later, but after that, we're going to get into Medicare, and then I want to talk for a moment on Social Security solvency. So what's new for 2023? Well, the big news, of course, is that there was a big cost of living increase, 8.7%. Everybody who collects Social Security, effective with their January payment, got a benefit that was 8.7% higher than it was in 2022. So that's obviously good news. It's hard to say anything bad about that, except that cost of living increases are really an after the fact increase, meaning that the cost of living through something called the Consumer Price Index was soaring last year. And that means everybody was paying higher prices for everything. And that's why we got the 8.7% increase. That basically means that we're kind of behind the eight ball because we already spent a lot of money. So at least the 8.7%, however, covers the higher prices to a small degree that we're still paying. Other things that have changed are the maximum taxable earnings that you pay Social Security tax on. You'll see in the chart, the 2023 number has gone up by about $13,000. You'll see the maximum Social Security benefit that one can receive is now $3,627 instead of $3,334. Let me just digress a moment on that. Very, very few people are even possible to make the maximum Social Security benefit. The reason is to do that, you would have to earn the maximum payroll deduction or meet the payroll tax cap every year for at least 35 years and then claim your benefits at your full retirement age. So that's the only way you can do that. And frankly, very few people ever achieve that. It costs this year about $1,640 to earn a credit to become eligible for Social Security. And the earnings test, which affects those who claim benefits before their full retirement age, went up from $19,560 to $21,240 this year. Brief mention on the bottom row that you see there, the earnings test is much higher in the year that you reach full retirement age. So who can collect Social Security? Well, of course, retirees, that is those of us who have worked pretty much our entire life. When we're 62 years of age, if we have 40 credits, which is about 10 years of work, contributing to Social Security, we're eligible to get benefits. Spouses of those who have earned Social Security entitlement, as well as ex-spouses if they were married for more than 10 years. Now, there are some other rules that go with that. It's not only just being married for 10 years, there's some other qualifications involved in that too. Survivors of deceased retirees have to be at least 60 or 50 if disabled, and that includes both current spouses and ex-spouses, as well as dependent children under 18, and dependent parents, believe it or not. If you have and are caring for a parent whose own Social Security benefit is less than yours, it's possible for your parent to get a higher amount. And also, of course, disabled people, disabled workers with enough who have worked and have enough quarter credits, which varies with age, or a disabled adult that started before age 22. Now, how's the benefit actually calculated? So Social Security has your lifetime earnings record, and they get it from the IRS every year that you have earnings. The IRS tells Social Security how much you earn, but they only tell you how much you earn up to the maximum payroll tax cap each year. So this year, the payroll tax cap is $160,200. Earnings above that don't get counted for Social Security benefit purposes. So what they do is they take all of your annual earnings from over your lifetime, and they adjust each of those earnings amounts for inflation. And every year there's a different inflation amount. And so it calculates your earnings based upon today's dollars, not on the dollars you earned back in previous years. So what they do is pick the 35 years over your lifetime that you earned the most amount of money, and considering the inflation adjustment. And then they divide that number, those numbers, they add it up and divide it by 420, which is the number of months in 35 years, to reach your average monthly earnings over your lifetime. And then they take that amount and divide it into three segments. And the segments are called bend points. But nevertheless, basically, it's dividing it into three segments. And those segments are introduced into a formula which computes your benefit. And what they essentially do, and it changes each year, the bend points or the size of the segments changes each year. The first part, the first bend point, which for those who become eligible in 2023, is $1,115. They take 90% of that amount. And then they take the amount over 1115 up to 6721, and that amount they multiply it by 32%, and that it also contributes to your benefit amount. And then if you make over 6721, you get 15% of that amount over that 6721. They take 15% of that and add it. The net of they add those three amounts up. And the net effect of it is that your Social Security benefit at full retirement age is going to be about 40% of your average index monthly earnings. And that's by design. That's by design because no one ever said that you'd be able to live on Social Security alone. So the benefit basically will almost always come out for initially 40% of your average index monthly earnings. Now, I can't emphasize enough that full retirement age is really critical when it comes to deciding when to claim for Social Security. That's the point, your full retirement age, which can be different, depends on the year you were born, but that's when you get 100% of what you earn for a lifetime of working. And your full retirement age depends on when you were born. If you were born before 38, it's 65. Actually, no one today is not collecting Social Security and using 65 as their full retirement age. Everyone today is going to have a full retirement age of between 66 and 67. So you can see the chart that says if your year of birth was between 1943 and 1954, your full retirement age is 66. If your year of birth is 1960 or later, your full retirement age is 67. And if you're in between those dates, then it's going to be 66 years and some number of months, depending on the year you were born. Now, the reason full retirement age is so important is that if you collect Social Security before your full retirement age, your benefits are going to be cut. If you wait and collect Social Security after your full retirement age, you're going to get more than that 100%. You can get actually up to 132% of your average index monthly earnings. Now, there's a lot of talk in various media today about the possibility of raising the full retirement age in the future. It's important to realize that's a very real possibility. In fact, we advocate for that in the AMAC Foundation. But none of that, any reforms undertaking will not affect anyone who's already collecting or already eligible to collect Social Security. This is just an interesting chart that shows the age at which most people claim Social Security. Obviously, the majority of people claim at age 62. It's kind of like I worked all my life. I'm 62 years old, so I'm just going to take my money and run. And a lot of people do that, and there's actually nothing wrong with that, except that you can get a lot bigger benefit for the rest of your life if you wait longer. The next highest category is at your full retirement age. So you see in between age 62 and your full retirement age, there's some people that still claim early, but later than when they first became eligible. And there's actually an increasingly larger amount of people who wait beyond beyond their full retirement age to claim. That is a good thing to do if your life expectancy says that you're going to live a long and happy life. So there is no one best age to retire. Everybody's situation is different. We get questions as simple as, I'm 65, when should I claim Social Security? And it's just not that simple. There's no one best answer to that. And our answer is actually always, it depends. Depends on your health and how long you expect to live. Depends on your financial situation. Do you need the money now? And it depends on your marital status and your concern for survivor benefits. But there's a lot of talk these days. You'll hear a lot of people in the media saying, there's talk about cutting Social Security because Social Security is going to run out of money. Social Security is going to go bankrupt. Social Security is not going to go bankrupt. It simply cannot, as long as there are Americans working. This is just a chart which kind of shows you or emphasizes the difference between claiming early and waiting until your benefits are at maximum. The blue represents someone with a full retirement age of 66. The orange represents someone with a full retirement age of 67. So you can see how the benefits grow as you wait longer to claim. Here's a kind of an interesting statistics for me. If you wait until age 70 to claim, your benefit is going to be 76% higher than if you claimed it at age 62. That's a big chunk of money. So a lot of people always ask us, well, when am I going to break even? What if I wait until my full retirement age instead of claiming at age 62? I'm not going to be claiming money from age 62 to my full retirement age. When will I break even? Well, the answer to that, and I've looked at this, I can't tell you the number of times, that you're going to break even at about 78 years old. So that means you're going to have collected the same, if you wait until your full retirement age to claim, when you are 78, you will have collected the same amount of money as if you had collected or started benefits at age 62. Similarly, if you wait until 70 to claim, you're going to break even at about 81. And if you wait, and that is to say, if you wait until 70 versus claiming at 62, you'll break even at 81. And if you wait until 70 instead of claiming at your full retirement age, you're going to break even about 83. I've looked at this so many times and it always comes out to be pretty close to these ages. So those are when you're going to break even. We hear from so many people that angrily say that I will be what I put into Social Security. And that is absolutely not true. What this chart represents, if you look at the four columns, the four orange columns on the left, you'll see those are four different categories of earners. The one immediately to the left is someone who has earned 50% of the average national wage index over their lifetime. The next one is someone who has earned 100% of the average national wage index over their lifetime, then 150%, and then somebody who has maxed out and always contributed the maximum and earned the maximum. The blue represents the amount of taxes that they paid in. The orange represents the amount of benefits that they will receive. So essentially what happens, moving to the chart on the right, is that someone in the first earnings category is going to break even after collecting about 34 months. The one at 100% of the national wage index, about 43 months. The next level, 150% of the national wage index, about 40 or 50 months. And finally, the one who is maxed them out will break even in just about 5 years. So it's when you hear people saying, I'll never get back what I put in, frankly, that's true for some, but you got to, of course, you have to live long enough to get those benefits. But most people, by far the majority of people, are going to get back from Social Security much more than they have ever contributed. So this is a big one. This working and Social Security is a big one, because I deal with people almost every day who have taken their Social Security benefits at age 62, completely unsuspecting that Social Security limits the amount that they can earn. So if somebody say, hey, I'm 62, I'm taking my money, I'm still working. Well, guess what's going to happen? They're going to get an overpayment notice from Social Security that says you owe us back thousands of dollars because you exceeded the earnings limit. Social Security has an earnings limit for those who collect Social Security before they reach their full retirement age. Now, the amount of the earnings limit changes each year. For 2023, it's $21,240. If you exceed it, Social Security is going to withhold $1 in benefits for every $2 you are over the limit. Now, the important thing to know is that once you reach your full retirement age, the earnings limit goes away. Now, if you retire mid-year and continue working, whoops, let me go back. It may be affected by a monthly limit. The monthly limit, as you can see there, $1,770 a month. What that says is if you claim Social Security during your first year and you earn more than the monthly limit after you start collecting, then you're not entitled to benefits for that month. So a lot of people get caught in that trap. Now, anything that is withheld, our late founder used to hesitate to call it a penalty, if you exceed the limit, because you do get some money back. When you reach your full retirement age, if you had benefits withheld for any months, they're going to give you time credit for those benefits. So theoretically, you can recover what was withheld, but you're going to have to live long enough to do it. So the important point is consider your future working plans when you're deciding when to apply for Social Security. Now, there's special rules for the year you reach your full retirement age. Generally speaking, anything you earn before you claim benefits and before you reach your full retirement age is not going to count. Whoops. I'm happy with my trigger finger here. But your earnings limit goes up in the year that you reach your full retirement age. So up to the point that you reach your full retirement age, in your first year, the year that you reach your full retirement age, you can earn up to $56,000 without it affecting your Social Security benefit. The penalty, if you do that, is a little bit less than it was in previous years. It's $1 for every $3 earned over the limit. And if this is your first year taking benefits and you continue to work, the monthly limit also goes up. Limit disappears in the month you reach your full retirement age, and there's no longer an earnings limit beyond that point. So are Social Security benefits taxable? Well, yes, indeed they are, much to the chagrin of so many unsuspecting people. But basically what it means is if your modified income levels are exceeded. Now, let me just explain what that is. They go by something called your modified adjusted gross income. Think of that as your income from all sources, your AGI on your tax return, plus 50% of your Social Security benefits. And that's what they mean by modified income. So if all of your income is over $25,000 as a single, you're going to pay 50% of your benefits are going to be taxable. And if you're a single and your modified income exceeds $34,000, then up to 85% of your benefits are going to be taxable. The numbers are different if married and jointly. In that case, if your total income from both are $32,000 or more, or over $32,000, then 50% of your Social Security benefits during the tax year are going to become taxable income. And if your earnings or your modified income is over $44,000, then up to 85% of your Social Security benefits received during the tax year are going to be taxable. Now, how are they taxed? They're taxed at whatever your IRS tax rate is. So if benefits aren't taxable if you don't reach those income levels, but to be very honest with you, most people today well, it is most, because those levels, the 25,000, 32,000, 34, and 44, they haven't changed since Social Security first became taxable in 1983. So obviously people's income increases. So more and more people are now paying taxes on their Social Security benefits. It is possible to have tax withheld from your Social Security benefits. It's actually quite simple. You just get IRS Form W-4V, fill it out, and submit it to your Social Security, local Social Security office. Social Security disability, those who have a physical or mental condition that prevents them from engaging in substantial gainful activity, and it's expected to last at least 12 months or result in death, and are under full retirement age, and they have sufficient Social Security work credits, can collect Social Security disability as soon as they become disabled. Now, Social Security is a slow-moving ship. It takes 3 to 5 months before you'll even get a determination out of Social Security if you apply for disability. However, they do have something called a compassionate allowance list, and there's over 200 conditions on there, which pretty much will get you a determination within a matter of weeks instead of months. The ones that are mentioned are ALS, Lou Gehrig's disease, for example, or really serious types of cancer and so on. But if you're approved, you cannot collect benefits for 5 months. So benefits are paid, actually start in the 6th month after your date of disability. In certain cases, end-stage renal disease, for example, or Lou Gehrig's disease, the waiting period is waived. There is also an option for spousal benefits. In other words, a recipient can get spousal benefits if they are disabled and collecting SSDI and they turn 62. So spouses, I mentioned briefly before, can collect benefits starting at age 62. And for spouses or ex-spouses who have a full retirement age of 66, they're going to get about 35% of a worker's primary insurance amount. PIA is essentially the same as their full retirement age amount. Now, you will hear so many people say the spouse benefit is 50% of the higher earning spouse's benefit. It is in certain conditions, and that is if it's claimed, if Social Security is claimed at full retirement age, the lower earning spouse will get 50%. But if it's claimed any earlier than that, they're not going to get 50%. I mentioned before, ex-spouses must have been married to a worker for at least 10 years and have not been remarried. In other words, they can't currently be married to one person and get spousal benefits from another. And if their own benefit is greater than they're entitled to as a spouse, then obviously they don't get spouse benefits. Survivors get benefits. They get 100% of the workers of their higher earning spouse's benefits, the deceased spouse benefit, as long as they were married 9 months or more, and they collect at their full retirement age. If they collect any earlier than full retirement age, they're going to get less than 100% of the deceased Social Security benefit. Ex-spouses, this is pretty much the same thing. If they were married for 10 years or more, ex-spouses can actually be remarried. If they remarry after age 60, they can actually get a surviving ex-spouse benefit from a previous marriage. 60 is the minimum age for survivor benefits, or 50 if the person is disabled. And they can claim earlier if this surviving spouse is caring for a minor child of the deceased. Dependent minor children and dependent parents can also get benefits, but there is a family maximum. Social Security just doesn't pay everybody the full amount. They compute a family maximum for each person, for each worker, and that is the maximum amount they will pay to dependents who are collecting benefits on that worker's account. This is one that confuses a lot of people because, not the chart, but the fact is that people think that when they get spouse benefits that it's an either or. So for example, people commonly come to me and say, I want to start my spouse benefits at age 62 and then collect my own benefit at my full retirement age. Well, guess what? You can't do that anymore. Used to be able to do that years ago, but that was changed. So now anybody who collects Social Security or claims Social Security will automatically be deemed to be receiving or to be applying for all benefits that they are entitled to. And a spouse benefit is kind of a supplemental amount, what we call a spousal boost, that's layered on top of the person's own benefits. So you can see there, one who is collecting a spouse benefit, if they are entitled to their own benefit, they always get their own benefit first, and then a spousal boost to bring them to what they're entitled to as a spouse. This restricted application, I'm going to just blow over this because this is something that is sunsetting. This was done away with. There are still very, very few people that are even entitled to this. To be entitled to it, you must have been become 60. I'm sorry, you must have been born before January 2nd of 1954. And your spouse must be collecting, and you must have reached your full retirement age, which of course they would have. So this is really something that's kind of off into the sunset. Cost of living increase. So it's determined each year by looking at the consumer price index for wage earners and clerical workers. That's the current index that's used. There's a lot of speculation about changing that to other measurements, but that's the one that's in force now. What they do with that is they look at the change over time on the CPIW, but only the third quarter of each year is used. So for example, to determine this year's COLA increase, they compared the third quarter of 2022 to the third quarter of 2021, and the difference became the COLA increase that we saw, 8.7%. And that's how it's done every year. So this year, they'll look at the CPI index in July through September, the average for those months, and compare it to the 2022 number, and that will be next year's COLA increase. Just for kind of information that don't quote me on, but it's very unlikely that the 2024 COLA increase will be very, very small, if at all. So what is the history of COLA? Well, you can see over the past couple of years, it's been really, really high, all the way over on the right. But whenever we're dealing with our clients, we encourage them to use about a 2 to 2.5 COLA for the future. In other words, this is what the average has been: 2.6% over the last 23 years, over the last 10 years, 2.5%. So although the last couple of years have been very high, almost, I'll say historically high, over the long haul, you could, for planning purposes, if you're doing any financial planning, you should really be looking at an average about 2.5%. The maximum taxable earnings for this year is $160,200. That's the amount that everyone pays Social Security tax on. 6.2% is FICA. If you're self-employed, it's just you got to pay twice that. But Medicare is 1.5%, and Medicare doesn't stop. So you reach when you contribute to Social Security, you contribute 6.2% up to the payroll tax cap. With Medicare, you pay the 1.45% Medicare on everything that you earn. The wage base, 160,200, is higher, obviously, and it's determined by changes to the National Average Wage Index, and that only changes only if a COLA is given. So the maximum payroll tax for 2023, that's the most that an individual is going to pay through FICA, is $9,932.40, and that's up $818 from last year. Now, this is an interesting chart because it essentially says that the amount of your benefit is going to be about 40% or less of your pre-retirement income. So if you look at someone who's kind of been a low wage earner, they're going to get about 40% of their pre-retirement income. If you the benefit is the darker color, the light beige on the left-hand side is their past average earnings. But you can see that those with higher incomes don't get that 40% there because they're getting a higher number of benefits or higher amount of benefits, but they're not getting anywhere near that percentage. Essentially, Social Security benefits are progressive in that they're kind of favor the lower income worker. That's by design. That's the way that the system was originally designed back in 1935. All right, the windfall elimination provision, and the next one I'm going to talk about is the government pension offset, deals only with those who work for a state or local government that does not participate in the Social Security program. In other words, state or local government SLG employees do not contribute to Social Security. For those who who have that kind of a pension earned from a state, and some older federal employees or retirees, or those people who also work outside of that employment and do earn Social Security benefits, they're not going to get the full amount of their Social Security benefit. It's going to be affected by this thing called the windfall elimination provision, which reduces any Social Security benefit that they're entitled to by, generally speaking, as much as 50%. The other one that is engaged whenever that condition exists, that is to say, whenever there's a state or local government employee who gets a pension that was not earned by contributing to Social Security, any spousal or survivor benefit that they're entitled to is going to be offset by 2/3 of the amount of their non-covered pension. For the most part, that eliminates spousal benefits for someone who has a pension, a government pension, earned without contributing to Social Security. And if it doesn't eliminate it, it's going to dramatically reduce the amount of the survivor or the spousal benefit. Now, Medicare. I may be talking to people who already know all of this, but there are basically 4 parts to Medicare. Part A, which is coverage for inpatient hospitalization services. Part B, which is outpatient services, and that's for doctors and medical tests and durable medical equipment and home health care and so on. Part D, which is for prescription drug coverage from private insurers. That's not, prescription drug coverage is not included in Medicare Part B. So some people get an extra private plan to cover their prescription drug costs. Part C is Medicare Advantage plan, which is private coverage, which in lieu of the original Medicare Part A or Part B, it's basically the services are administered by a private company who usually and often offers additional coverage that original Medicare doesn't include. And that would include prescription drug coverage, and sometimes it also includes vision and dental. So think of it as a supplement. It's not really a supplement plan, it's just an alternate to original Medicare Part A and B. Part A is free to those who are eligible to collect Social Security. Has a standard 2023 premium of $164.90, which, by the way, is down from last year for reasons which I don't need to go into. Part D premiums vary by the provider and the plan selected. And Part C may or may not have an additional cost. In any case, if you take a private Medicare Advantage plan, you still have to pay the Part B premium, that $164.90. That money essentially goes to the Medicare Advantage private Medicare Advantage provider. Doesn't all go, obviously, the government doesn't want to give it all up, but largely the 164.90 goes to the Medicare Advantage provider. We had a lot of questions on, how is Medicare funded? I'll just give you focus on the three right circles here. Part A is funded 90% by the taxes, payroll taxes that are paid by people. Part B is funded mostly by general revenue. Generally speaking, the premiums that we all pay for Medicare Part B really only represent about 25%, or when aggregated across everyone, represents only about 25% of what Medicare Part B actually costs the government. And Part D, you can see also that most of it is really paid by general revenue. Medicare doesn't cover everything. It just simply doesn't. It doesn't cover prescription drugs, except in the rare case, if you get prescription drugs while you're in the hospital, those drugs are generally covered through Medicare Part A. But if you have a general plan that you want to get prescription drugs, it's not covered by Medicare Part B. Eyeglasses and exams to get them aren't covered. Hearing aids aren't covered. Dental care or dentures aren't covered. Long-term custodial care isn't covered. Acupuncture, and routine foot care aren't covered. Medicare does have a whole bunch of services that they do cover, but they only pay 80%. 20% is copay. And the copay, there's also a deductible before I get on to copay, which you can see there on the chart. For Part A, it's $1,600. And for Part B, it's $226 this year. Those deductibles change every year also. But the copay is often, many people get a supplemental plan to cover the copays and the deductibles that Medicare doesn't cover. Those are called Medigap plans or supplemental plans. And many Advantage plans will cover those deductibles as well. There are literally thousands of Medicare in the market. All depends on where you live, what the county you live, what your zip code is, and so on, as to what's available and what they cover. So, do you have to take Medicare at age 65? Well, that's your initial enrollment period, 3 months before 65 and 3 months after. But if you're working and you have creditable healthcare insurance, for example, from an employer, you can wait, you can delay claiming Medicare Part B and thus avoid the monthly premium for that. But if your insurance isn't credible, if your employer healthcare plan isn't credible, and you wait and claim outside of your initial enrollment period, there's going to be a late enrollment penalty. I won't even attempt to take you through this chart. Some of you may know what IRMAA is, I-R-M-A-A. It's the income related monthly adjustment amount. It basically means that depending upon your income, your modified adjusted gross income, and your tax filing status, you can pay a much higher Medicare Part B premium. Where this catches a lot of people, especially new retirees, is people who decide to take a withdrawal for some reason or another from their tax deferred savings plan. They take a withdrawal that gets counted as taxable income, and guess what? They get hit with a big Medicare premium because they took that withdrawal. And just kind of to wrap it up, Social Security solvency. We are very active in this. Frankly, it's a problem. The trustees of Social Security do a deep dive on Social Security's financial status every year. And for decades, they have been telling Congress that Social Security is going to run out of money in the mid-2030s. Congress has kicked the can down the road for decades as well. But what is the problem? Well, the problem is that people are living longer, and the ratio of workers contributing to beneficiaries is declining. That is to say, the people that are paying into Social Security are growing at a slower rate than the people collecting benefits. So what can be done about that? The Congressional Budget Office does a separate deep dive, and they say, even though the trustees say Social Security is going to run out of money, the trust funds are going to run dry in 2035. The Congressional Budget deep dive also and said that's probably more likely going to be in 2023 or 2033, which is a mere 10 years away. What would happen is everybody's benefits, if those trust funds run dry, everybody's benefits are going to be cut by somewhere between 20 and 25%. We generally use 23%. So what's going to happen is, unless Congress does something, everybody who's collecting Social Security is going to see an almost immediate, well, and immediate 23% cut in their monthly benefits. So how to develop? We're living longer. When Social Security was first enacted, average life expectancy for a man was 61, for a woman was 65. Today, someone who reaches Social Security eligibility age is expected, a man is expected to live to 84, and a woman is expected on average to live to 87. So instead of paying benefits for just a few years, Social Security is now paying benefits for decades. Interest rates are at historic lows, which affects the return on those funds that are invested in the Social Security trust funds. And so the solutions that are being discussed to solve this problem are to gradually increase the full retirement age from 66 or 67 to age 70, make adjustments to the benefit calculations to keep lower earner benefits whole and slightly lowering benefits for higher earners. And to what AMAC is proposing is to implement a guaranteed across the board COLA increase using an average amount, eliminate the Social Security's earnings test, and increase the thresholds for federal income tax. In other words, those things I mentioned before, those thresholds for taxation, which haven't changed since they were enacted in 1983, and actually there were two levels, 83 and 93. They haven't changed since they were enacted. So we advocate for increasing those thresholds at the thresholds at which Social Security benefits become taxable. And we want to increase also the benefits for surviving spouses. So with that, I'll just say thank you. It's been a pleasure to be able to speak with you folks. This seminar is really part of what we do on a fairly regular basis. I've given you sort of a scaled down version of the one that we present live. Each year we present it live where people can come in and sit. We work out of our Lady Lake office, and the seminars are held in that vicinity. Security Advisory Service is available free to the public at any time. You don't have to be a member of AMAC to take advantage of our services, although we would love to have you join. And the website that you see there, amacfoundation.org services, will give you direction on how to access our Social Security services. But you might also want to look at those websites. For just for reference, if to email us, it's pretty simple. You just do ssadvisor@amacfoundation.org, or you call us at 888-750-2622. So with that, I guess we can open it up to questions.
Great. All right. Well, we are coming up on the top of the hour. We got 4 minutes left to cover 3 questions. So 4 questions because I see a hand raised. I'll start with Dan very quickly. He thought that benefits were calculated based on your highest 10-year stretch of earnings, but it's actually on the 35 years? Because I had heard 10 years before too, Dan.
No. You garbled a little bit, but I think your question is, you heard that Social Security is based on your last 10 years of earnings?
Your highest 10-year stretch of earnings.
Yeah, well, that's not true. Those highest 10 years are going to obviously be included, but it's your highest 35 years. You know, I will confess that I claimed Social Security at age 62, and that was before I know what I know now. If I had known that, I would have understood that my highest earning years, which I was in, have a very big effect on it, but it's 35 years over my lifetime. That is what benefits are calculated from.
And then this is kind of a great follow-up question from Terry. If someone was in a high earnings for 10 years and then goes to work part-time and makes a fraction of that, does that mean the part-time work actually brings down the Social Security monthly earnings?
No, it doesn't really bring it down, because they're still going to have 35 years in their lifetime earnings history. So it's not going to affect it. It actually could help if they don't have 35 years in their history, because what Social Security will do, if you don't have 35 years in your earnings history, they're still going to compute it as though you do, and they're just going to stick 0 in for enough years to make it 35. So let's say you claim your benefits, or you earn less, you go to part-time work, you're still adding money in and bumping out one of those 0 years to be able to to be included in the 35-year calculation.
And then just one more question before we get to you, Mary Elaine. What if the ex-husband remarries someone else? Can the first ex-spouse still collect if married more than 10 years?
Can the first ex-spouse collect if they're married, if they were married more than 10 years?
If their spouse remarries, I guess, can both wives collect on that one person?
All right, so here's the rule. If you married and you were married for 10 years and then you divorced and then remarried. If you were remarried, you cannot collect a spousal benefit from your first spouse.
What if your husband remarries somebody else?
If your husband
collect on him?
Your first husband?
Yes, if you don't remarry and your first husband marries another woman.
Yeah, and it doesn't, then that doesn't matter. That does not affect your spousal benefit or your ex-spouse benefit at all. I'll use the husband-wife thing. I hesitate to do that, but if a husband remarries and his first wife doesn't, and she's otherwise eligible for ex-spouse benefits, they were married for 10 years, and then she can, it doesn't matter that the husband remarried, she can still collect, the ex-wife can still collect benefits.
I think that was the question, Terry. And then thank you for being patient. I see your hand raised. I'll let you go next.
Thank you. I appreciate that. Russell, my friend says that Social Security only captures like your main jobs payroll information. So for example, there were years when I had like 3 or 4 jobs. Social Security would only take the largest amount and not include the additional income that I made for that year. So my friend is saying that Social Security is not including the additional income that we've made for the year. Is that true or not?
Well, I mean, I hate to get between friends, but I'm sorry, it's not true.
Okay.
Social Security gets information from the IRS. If the several jobs that you are working all pay Social Security tax and are all reported to the IRS, then the IRS is going to give Social Security those numbers.
Okay. It seems like in some cases it hasn't worked that way. So I appreciate knowing that.
Let me say this. There are instances where someone thinks that Social Security has incorrect information, then they should discuss that. They should call Social Security and report that. And let me say too, that you should be able to get a transcript from the IRS of all of your contributions and all of your earnings. And Social Security will accept that transcript as proof of your earnings, and if appropriate, will give you credit for those earnings.
Okay, thank you for doing that. I'm just thinking maybe I know some of mine may not be included because I was not a direct employee. I was a contract employee, so I wasn't collecting benefits.
Well, even so, you would still get a 1099,
Okay,
right? Which you would need to claim on your income tax, and that would be included where what the IRS would report to Social Security.
okay, thank you.
Mhm. Well, it's been a pleasure, folks. I hope you all learned some stuff here today. Just let me reiterate that we are free. You can always come to us for Social Security information. I think I mentioned earlier that we deal on a fairly regular basis with professionals like yourselves, who have a client base who come to us. The professionals come to us to get answers for their clients. So we're perfectly happy to do that, and we don't charge. There's no charge for it. We're a nonprofit organization. We live entirely on donations. So
That's great. Well, thank you so much. Thanks for joining us. And we, NAIPC, actually have a table at their event in Florida, in Wildwood, Florida, at the end of the month. So I think that this presentation and that event will be something, a good partnership where we can help educate older adults and those that serve them. So thank you, everyone, for joining us today. If you have any follow-up questions, I will be happy to send them along to Russ. And I hope to see you again soon. Thanks,
okay,
everyone.
thank you.